the 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 pain in the shoulder normally leads to pain, restriction of the movement in the shoulder. So the movement in the shoulders are internal rotations, external rotations, abduction and flexion and extension. The reason for which all these movements get restricted are due to injury in the four muscles, which are supraspinatus, infraspinatus, subscapularis and long hand of biceps. These muscles either get torn or swollen. Once this happens, the pain restricts the shoulder movements. So our primary mode of treatment will be to increase the mobility first, then strengthen the muscles. The first, once there is pain in the shoulder, we will try to mobilize it without aggravating the pain in the shoulder joint. So the first movement which will start, which avoids the gravity, is the tabletop passive shoulder joint flexion movements. So we will sit down on the side of the table and gradually extend the shoulder along the table till we have got total extension of the shoulder joint, and maintain it for 10 seconds, and we will repeat the cycle 10 times till we will do it within the limits of the pain threshold, or will not try to aggravate the pain in the shoulder joint. So we will do it 10 cycles of the joint, that is flexion and extension of the shoulder joint. Once we cover the flexion and extension of the shoulder joint, we will try to go do a wall climbing by the fingers for looking at the anti-gravity flexion and extension of the shoulder joint. We will take the support of a wall and keep our fingers on the wall and start to climb up the wall with the fingers, and we will gradually come closer to the wall. And as we come closer to the wall, gradually the fingers keep on moving. We will try to not aggravate our pain, and with the support of the shoulder wall, we will gradually move the shoulder up and up till we reach the maximum flexion extension of the shoulder joint. Then we will do it for and maintain it for 10 seconds each time, and do it for 10 cycles up and down. So this will be our first range of movement till we have got gradual full movement range of the movement of the shoulder joint, the flexion and extension. This movement takes care of the tone by long head of the biceps, which is an intracapsular tendon, as well as the tight capsules. Once the tight capsule gets stretched, at the long end of biceps also gets stretched. So we will look at the next muscles, which is the infraspinatus muscles, which takes care of the internal rotation and external rotation of the internal rotation of the shoulder joint, which is done by the infraspinatus muscle can be done passively by the help of the towel exercises. So what you will do, take a towel and take the arm which is painful will remain lower, and the shoulder which is normal will come into the upper side. So we'll hold it with the both hands, and with the normal shoulder joint we'll try to pull it up, so the affected shoulder gradually internal rotates till you have got a range of movement which is pain free. And once we get this internal rotation, and we will try to maintain it for 10 seconds and repeat the joint movements for 10 times.